Have you ever experienced persistent pelvic pain, unusually heavy periods, or discomfort that just doesn't seem to have a clear explanation, often for years? Endometriosis is typically diagnosed with certainty through a minimally invasive surgical procedure called a laparoscopy, where a surgeon can directly visualize the endometrial-like tissue growing outside the uterus and often take a small biopsy for confirmation. The reason this surgical approach is considered the gold standard is because the symptoms of endometriosis, such as chronic pelvic pain, painful periods, and pain during intercourse, can overlap with many other conditions, making a definitive diagnosis challenging without direct observation. This condition involves tissue similar to the lining of the uterus, known as the endometrium, growing in places it should not, like on the ovaries, fallopian tubes, or outside of the uterus itself. These growths respond to hormonal changes, leading to inflammation and pain. While a laparoscopy provides the clearest picture, the diagnostic process usually begins with a thorough discussion of your medical history and symptoms with your doctor. They will ask about your menstrual cycles, pain levels, and any fertility concerns. This is often followed by a physical examination, including a pelvic exam. Sometimes, imaging tests like an ultrasound or a magnetic resonance imaging scan, often called an MRI, are performed to look for larger endometrial cysts, known as endometriomas or deep infiltrating endometriosis. However, these scans usually cannot detect smaller implants or adhesions, which is why surgery is often necessary. During a diagnostic laparoscopy, the surgeon makes a tiny incision, usually near the navel, and inserts a thin, lighted tube with a camera, called a laparoscope. This allows them to carefully inspect the pelvic organs for any signs of endometriosis. They can identify the characteristic lesions, which can appear as reddish, brownish, or bluish spots, or as scar tissue. If any suspicious tissue is found, a small sample, or biopsy, is collected and sent to a lab to confirm the presence of endometrial cells. Understanding this thorough diagnostic process empowers you to advocate for yourself and work with your healthcare provider to find answers. Getting an accurate diagnosis of endometriosis can be a pivotal step in managing your symptoms, exploring treatment options, and addressing any fertility challenges you might be experiencing, ultimately improving your overall well-being and quality of life.